We do anticipate that there will be an increase in cases in intensive care. When you catch COVID, it normally takes a few days to develop symptoms, and then another few days later at home you start to establish, are you going to get better or are you becoming sicker and need hospital admission? Once you're in hospital, it's often a further few days before you know, are you going to get better just with ward care, or will you in fact require to be admitted to the intensive care unit?
Right.
And so there is quite a lag between the diagnosis of COVID and establishing whether you'll need intensive care or not in many instances.
So far there's only been single cases of Delta cases in ICU, so why are you worried?
I think because we've seen moderate numbers of new diagnoses every day, we probably will get into double digits. The rule of thumb is that for every 100 patients that are diagnosed with COVID, around 15 will end up being admitted to hospital, and of those 15, between 2 and 4 will need some time in intensive care.
Yeah, but we do have like 500 odd cases, so therefore the math says that we will get double digits on that kind of formula. Is that right?
Absolutely. We would anticipate that we'll get into double digits.
OK. Some epidemiologists...
Hopefully low double digits.
Yes, hopefully. But some epidemiologists are saying that we've got a 50-50 chance of this elimination strategy working. If we don't and Delta spreads, how prepared is our national ICU situation?
Well, I think it's fair to say, and everyone should be aware of this already, the intensive care system in New Zealand almost always operates under some degree of stress anyway. Prior to COVID, on normal day-to-day operations, we fairly regularly have to postpone elective surgery that requires intensive care afterwards. So cardiac surgery, sometimes even cancer surgery gets postponed because we don't have sufficient nurses to care for these patients after their surgery. So COVID has clearly added a stress to that, and I think it's a measure that we recognise that stress and capacity constraint, that in anticipating that the numbers in Auckland will rise in intensive care, we've had some wonderful nurses volunteer to go up and help the teams there so that the patients in the Auckland ICUs, both those with COVID and those without, can get the very best expert care that they need.
Well, let's talk about that in a moment. But I mean, can you tell us if the ICU is already around the country is already under stress without COVID? Have you ever been in a situation where the ICU has been overwhelmed? Can you describe that?
Personally, I've never been in a situation where it's been overwhelmed. Normally, when the ICU gets very distressed, we actually start to transfer patients out and share the load with other intensive care units. The crunch point arises if we get more cases than that capacity and flex in the system can cope with, because then we would have to start to use some of the pandemic beds that we have been preparing over the last year.
Yeah.
So we do have now an additional around about 250 monitors, ventilators, pumps and other pieces of life support equipment that we can use to open pandemic beds, but they won't be staffed in the normal way. And we don't want to get into the position where we're caring for patients by staff who are not necessarily as familiar with those bits of equipment as our own staff.
Right, so you're talking about the surge capacity. If we do get into the situation where we need surge capacity, that's, you've got nurses from other areas being trained up in ICU equipment like you have behind you. What happens to the level of care? Will they be as good as ICU nurses?
So behind me you see a selection of the ICU life support equipment that we use on a daily basis, and just from the amount of equipment there you can gather that it takes quite a long time to train, and an expert ICU nurse would probably take 4 to 5 years to train to become familiar with all the equipment that's there. And in pandemic surge mode, we would, instead of having every patient with one intensive care nurse, we would have perhaps every second patient. It depends, obviously, it's just a ratio depending on the demand, but maybe every second patient has a non-intensive care nurse that's done the additional training, so they're familiar with the basics of ventilators, they're familiar with the basics of monitors, but they'll be supervised by an intensive care nurse in the adjacent bed space. So that's not the same.
Yeah, the bottom line is the care level's not the same, is it? It can't be, because you can't train an ICU nurse up in a few months.
No, it does take considerably longer to train an ICU nurse.
Yeah.
But they will still be cared for by very dedicated nursing staff,
absolutely.
and there will be oversight. But the evidence from overseas is that once you start to use your pandemic and surge capacity, that you don't enjoy quite such good outcomes.
Okay.
And so that's why it's so important, as I say, to obey the public health advice or follow the lockdown, and more importantly still, as soon as you're eligible, have the vaccine. Because what we do know from internationally is one dose of vaccine will almost certainly save your life, and 2 doses of vaccine really reduce your risk of needing hospitalisation or intensive care dramatically.
With hospitals knocking down walls to create new negative pressure rooms for COVID patients up in Auckland, it seems a bit last minute, don't you think, given that the pandemic has been here since March 2020?
We've relied very heavily in New Zealand on what's been an excellent public health strategy to eliminate COVID. In the initial variant of COVID, there was less concern about airborne spread. And so the negative pressure aspect of things was much less important, because people were largely focusing on transmission of this via droplets. I think that may have contributed to the slight delay in looking to upgrade and make everything negative pressure.
So Delta has
changed.
The
characteristics have changed.
Yeah, so, OK, which, like Dr Bloomfield says, we're dealing with like a whole new virus. I guess the final question is, I mean, Australia this week is doing an urgent stock take of its ICU capacity, given that New South Wales and Victoria seem to have given up on eliminating Delta. Is there any way that we can avoid that situation?
Absolutely, and we absolutely hope to avoid that situation. If everyone obeys the lockdown, follows the lockdown and observes all the rules, the hand hygiene, the contact tracing app is used every time you go out, minimise any unnecessary journeys, then we should see the level of transmission in the community go right down and be stamped out again. At the same time, the other part of that equation is very much vaccinate, vaccinate, vaccinate.
All right, Dr Craig Carr, thank you very much for your time.
Thank you.